Hello, my name is Christine Cartwright. I'm an instructor in the Patient Care Tech program here at Central New Mexico Community College, and this is CNM Glass. This is the first in a series of videos that I will be doing introducing you to medical terminology. We'll be using this to build a vocabulary as you go along. So one of the tools we're going to need is a set of index cards. This lesson's going to be a little longer than your future lessons, so never fear. But I want to build a base that we're going to use throughout the entire set of lectures, because you'll see as you shuffle and put down your index cards that you can combine them in many different longer terms that you're going to hear commonly used in the hospital when you get to your clinical rotations. So go ahead and open your cards, and the first card, I want you to write itis. Itis will go on the front. And itis means inflammation. And that word will go on the back. So you'll have an index card. On the front it will say itis, and on the back, inflammation. The next card, we're going to write ology, O-L-O-G-Y. You're probably actually familiar with ology because in high school perhaps you took biology or psychology. So ology really means the study of. So ology means the study of something, and we're going to get to that soon. Now on your next card, write ologist. If ology is the study of something, the ologist is the person who studied it. So we say this person specialized in the study. So the person who specialized. Okay? So you should have 3 cards, and this is the way that it's going to work. Itis on the front, inflammation on the back. Ology on the front, the study of on the back. An ologist, person who specialized. Now let's look at some of our key roots. We're going to have roots, we're going to have prefixes, we're going to have suffixes. Suffixes are endings. Prefixes are words that come before, that indicate something about the middle of the word. So on our next card, I want you to write dermat. Once you've written dermat on the front of the card, go ahead and turn it over. Do you know what dermat means? Dermat means skin. I like to start with this one because a lot of us already know and use the word dermat in our life. Dermatology, you see that on commercials all the time, especially dermatologist. You had a skin condition, you had acne as a teen, you had psoriasis, you had eczema, you had some weird rash that your mom took you to the dermatologist to get treated. All right, our next card, oddly enough, is cardi. Cardi is another one that you hear a lot, and cardi means heart. You've probably heard of the cardiologist. Perhaps someone in your family has a heart problem and goes to see the cardiologist in the cardiology department at the hospital. When you're making these cards, or when you take them home to study them, if there's something that you automatically associate or that will help you with this, go ahead and draw a picture, write a phrase, color a shade, something that will help you visualize these words. So for cardi, you might put a heart. All right, our next card today is gaster. Gaster. Gaster, turn your card over and write stomach. Gaster means stomach. You hear of this a lot in daily life when you're listening to people talk about weight loss. They've had weight loss surgery. They had the gastric banding or the gastric bypass, right? Gaster means stomach. The next card is nephro. Nephro means kidney. So for people with kidney failure who are on dialysis, they probably go see their nephrologist for orders about that. Or you may work in the nephrology department at your hospital. If nephro is hard for you to associate with kidney, you might think nephro sounds like nephew, and a nephew is your kid. So maybe nephro, kidney, nephew, kid. You might draw a kid on the card if that will help you. Otherwise, nephro is kidney. Our next card is rhine. Rhine means nose. I don't know, maybe you're a talented artist and can draw a rhinoceros. Not me. Rhine, nose, another one that you're going to hear if you watch those plastic surgery TV reality shows. Everyone's going in for rhinoplasty. They're going for their nose job. All right, next card is cyst. Cyst means sac containing fluid. Now perhaps you've had a cyst before on your skin somewhere that's been drained. You could feel it was this fluid-filled sac. But we also refer to our urinary bladder as a cyst. It is a sac containing fluid, urine. So if you put cyst with itis and get cystitis, the inflammation of the bladder, that's what happens during a urinary tract infection and causes all your signs and symptoms. Itis can go with dermat too, dermatitis, inflammation of the skin. Perhaps you had a red itchy rash and the doctor said, I don't know, maybe it's contact dermatitis. Are you allergic to some kind of soap? Did you use a new laundry detergent? Gastritis, sure you've probably heard that. There's 1,000,001 drugs for that now. Rhinitis, inflammation of the nose, usually during cold season. If you watch the commercials carefully, they talk about runny nose, rhinitis. All right, let's move on. Next card, mast. Mast is one you hear a lot about because of people having mastectomies when we're asking our blood pressure questions. So what does mast mean? Mast means breast. We're going to learn ectomy in another lesson, but right now if you put mast with itis and got mastitis, that's an inflammation of the breast, and you might hear that if you're working on a postpartum unit or with women who have recently had babies who are breastfeeding and their breast gets inflamed, sore, there's a problem with the milk emptying and they have mastitis. I'm going to build a couple of words now, so let's get a new card and we're going to talk about cephal. Cephal means head. So back to having babies, since I just talked about mastitis, babies are supposed to be born head first, and that's called a cephalic presentation. Cephal. On another card, if you write EN, N just means in, and you're going to see that in a couple of other ways as well. But N means in. So if I make now a third card, and on it I write encephal, what does that mean? In head. So what's in my head? I'm hoping a brain. So encephal means brain. So perhaps a couple of years ago you're watching TV, or even as recently as this year, you hear about the West Nile virus and the mosquitoes, and they're all upset because West Nile virus causes encephalitis. So they're talking about how terrible encephalitis is, and now you know that's actually several words, meanings, put together for inflammation of the brain. And yes, that's a bad thing. Okay, let's do a new card. Let's talk about fascia. This one's a little bit harder to visualize. Fascia means sheet or band. We in the OR, if you're thinking about specializing in the OR, talk about cutting into the fascia, sheets and bands of tissue, muscle all the time. But more commonly, where you might have heard it previously, is if you've had plantar fasciitis. Plantar fasciitis. That is inflammation of this band of fibrous tissue that runs from your heel up through your arch to the top of your foot. So if you've ever had that sore foot where you're limping along because the whole bottom hurts and someone says, "Do you have plantar fasciitis?" That was these two words right there. The next one is neuro. Neuro means nerve. Maybe you know somebody with seizures and a seizure disorder, and they went to see the neurologist. We're also going to cover, new card, appendix. Appendix, pretty easy. On the back, you're going to write appendix. It's just that the ending changes when you're using it in a longer word. I think earlier I mentioned mastectomy, and we're going to talk about ectomy another time. Another surgery you hear a lot about is an appendectomy. So we're getting from this root of the word. Let's also talk about esophage, E-S-O-P-H-A-G. And that's referring to your esophagus. And that, remember, that's the tube that kind of runs from the throat down to the stomach. So if you have esophagitis, it might be because your gastric juices coming from your stomach are very acidic, and they're coming up into your esophagus because you have reflux and causing inflammation. So esophagitis is inflammation of this esophagus, that tube that leaves the stomach that comes up the throat. Your next card is hepat. Hepat means liver. And you can remember this one pretty easily because I'm sure you've all had your vaccinations for hepatitis. And remember, hepatitis is an inflammation of that liver. I know you got your shot for hepatitis B, and there's B, C, and D, and those are all blood-borne hepatitis. And there's A and E, and those are oral fecal type of hepatitis. When you hear somebody has hepatic issues, you know we're talking about their liver. One I know you're all familiar with is Arthur. Arthur means joint. So if you put your Arthur card in front of your itis, you would have arthritis, inflammation in your joints. Remember, we have a couple of different kinds of arthritis, rheumatoid arthritis or osteoarthritis. You're going to see ost in a new lesson talking about being bone, and you're going to slowly put together when someone says osteoarthritis, you're going to have three things happening in your mind, and you're going to understand. The last one we're doing today is phleb. Phleb means vein. You're all in phlebotomy right now. And otomy is another term that you're going to learn in a future lesson.